What was the biggest surprise for you from participating in this weekend? Unexpected pleasure, perhaps.
I think part of the unexpected pleasure was just experiencing the community that is around this work at the intersection between art and medicine, or art and healing. It's incredible when people come here and bring their creative energies and creative spirits, and whatever way they find creativity in their world, and bring it to the service of others and to help others heal. I find that there's a lot of integrity there, there's authenticity there, and when people engage with one another from that place, a community can form very quickly. And I think that's one of my real surprises here. I've been to many conferences where I get to engage with people doing incredible work in science and medicine and social engagement. But I've never been to a place where, just in a matter of a day, where I've been able to connect with individuals and establish friendships. And I think part of that is because people are coming here with that kind of integrity. But also, I think that there's something about art and creativity that helps us lower our defenses, and it becomes a greater community kind of spirit. So I think that's one of the surprises I've had.
Was there any one? So you were inspired by the community and excited by it. I mean, you connected with people.
I think
Was
so.
there any particular expression of art or creativity that inspired you for use in your work?
Yeah, well, I would actually say that this entire work that we're doing with the connection of art and medicine, or even dance and medicine, since that is really a focus of this venture here, has so much to teach us in medical education. When we think about clinicians and the work that we do, it is inherently physical. It's inherently using our entire bodies, all of our senses. And that's something that dance really captures. It is you're using your entire body to be able to perform, and your creative energy goes through your entire body. And I think that's such an important lesson for clinical medicine, because it's not that we can't read a book and read medical articles and take care of patients intellectually. We physically have to come into those rooms. And so what we can learn from dance and learn from art is how to harness the powers of our body, the powers of our senses, to be present physically with another to provide care for them, is a very important lesson that we learn from dance, I think. The second thing is, there's really a growing movement right now where medical education is recognizing the importance of what we're learning from creative ventures as a whole. Clinical work, if it's done well, is always creative. There's always spontaneity in clinical work. If you try to apply the same approach of clinical work to every patient with a given diagnosis, you will reach a level of competence perhaps, but it will never rise to an art form. It will never rise to something that is transcendent. And when we watch a beautiful dance performance, it transports us to a higher level. And it gives us a clear understanding of what is possible. And that type of experience can happen for physicians. That type of experience can happen for nurses and social workers in the healthcare space. And I think that's what we're learning through this. If we can help that creative energy come out for our healthcare workers, so that they can conceive of their work as an art form, in the same way a dancer sees that their work is an art form on that dance space, that same type of enjoyment, that same pleasure can occur for them. And what's amazing is that if that occurs for the physician, it's always occurring in concert with the patient that is there. So that participation of the patient is always a part of that creative venture. And
so it's not just about taking a creative leap beyond the facts as found, but in relationship creating something different.
That's right. That's right. And I think that if the clinician can really tap into the present moment and recognize that what's happening in that present moment with that patient in front of you has to be a creative act. We have to draw upon our creative spirits and energies to be able to serve that patient at the highest level. It's going to result in better care for that individual, and secondarily, it's going to result in greater satisfaction for the doctor as well as the patient, because we know that we're honoring the unique nature of that particular moment in time and that particular patient. And ultimately, I think that the patient ends up being seen as a full person when the doctor is truly responding in a unique way to the individual there. And that can't happen with checklist medicine. That it can't happen purely by following guidelines. And I think we learn that from the creative world, in that we draw upon our creativity to be able to meet the needs of that moment with whatever resources we have at that time.
So if you had to summarize the symposium of the last 2 days in a sentence, what would it be?
By tapping into one's creative potential, one unlocks passion. And I think that's what we're trying to do for our students as well.
Great, thanks.
Thank you.